Good afternoon, everyone. Welcome to Cook County Health Department's school health meeting for December. I am so glad that you are able to make it. I know this is a busy time of the year and the last day of the year for a lot of schools, so I'm especially happy to see those who were able to make it. So let's get started. Our agenda today is we have a few updates, some announcements, and our CCDPH Communicable Disease Department will give us an update. And then we are thrilled to have a presentation from the Lincoln Option Center, which will talk about their community-based resources. Our objectives for our meeting are to keep you guys informed and get the most up-to-date information and guidance to navigate issues related to health and wellness with schools, resource sharing, access tools, and provide community support in any way we can. Little housekeeping, please keep your mics muted and feel free to put any questions in the chat. We'll be glad to answer them. And all of our webinars are recorded and they're uploaded to our CCDPH website as well as our YouTube page if you missed anything. Couple announcements. Registration for the next series of meetings are ongoing. We're going to have them on a monthly cadence instead of recurring because we're having some issues with our platform. But if you would like to scan the QR code, and you'll be able to get access to our website, which will show you the links for all the meetings when they're uploaded, as well as the bottom QR code would get you the sign up for our newsletter, where any announcements that we have will be available to you. Those go out monthly. Here is the registration for our January meeting. You can scan the QR code. It will be on our website as well. Our January meeting will be January 16th. Same bat time, same bat channel. And the Illinois Public Health Institute will be here to discuss their policies for free school lunch. So we look forward to seeing you at that meeting. For conference CEUs for nursing, I have received some inquiries from people, and I have to dutifully apologize as our provider has had some staffing issues and they weren't able to immediately fulfill those. I just spoke to her today. She said she's going to work on that this weekend and hopefully you guys will get there soon. And I apologize for how long it's taken. Sometimes it's out of our hands, but I have not stopped working to get that fulfilled for you all. Here is contact information for CCDPH. If you have school-related issues that you'd like to report, general questions, and webinar-related questions, you can email the Healthy Cook line. If you'd like to report line lists and report communicable disease or have any metrics questions, and you can email the CCDPH schools email, as well as other Cook County Health Department websites and email addresses that you can reach us on. A few resources. I am no longer the contact for the EpiPen and the asthma program, so the information is here listed in the slide. You can contact them at, there's a specific website that has been set up to do your request, and there's an email address that is at the bottom of the slide that you can contact them on. If you are automatically enrolled to the Rescue Illinois program, you're automatically opted in and you'll receive those materials. If you have any questions, you can contact Naomi Soto, whose name is on the slide, for any questions or information regarding that. For naloxone requests, you can contact Denise Holman, who is our opioid health educator, and her email address is listed. CCDPH Nursing has implemented our, as of September 2024, implemented our vision and hearing program. Currently, it's only ages 3 to 5 with plans to expand it to school-age children. But if your school organization would like to secure CCDPH for a vision and hearing screening, you can contact them at the email address listed. CCDPH has flu and COVID vaccination clinics going out through March of next year at various Cook County clinics. The information and the dates are on those slides, so feel free. If insurance is not required, but if you do have insurance, they will bill your insurance. Here's other vaccination resources. This is a time of year that a lot of schools and organizations secure these mobile vaccination clinics so that they can have them for the summer in order to be compliant for next school year. So this is the time to contact them now as their schedules fills up pretty quickly. some mental health resources. Our behavioral health unit gathered some mental health resources and put them all on one resource slide for your convenience. And here's the number for the suicide crisis line, as well as 211, which is a nationwide help service line. You can text or use their website for 211. Information on a back to school grief support group, as well as some NAMI school specific materials and NAMI family to family support groups that are going on starting next month. Information about Metropolitan Family Services Mobile Crisis Response. And this is our upcoming presenter who will give us a little bit more detail about some of the programming that they have. As well as another partner, Rincon has their mental health first aid classes, as well as information from Sertoma for their mental health classes. CETA is a community partner that we hope to have later on this school year to come to present to talk about their community offerings. But this just lists, the second slide lists the information that they have and the programs that they offer, as well as you can scan a QR code to go straight to their website, as well as they offer a vision assistance program if you qualify in the financial range. So it's great information to have and to share. And like I said, they have many more programs, and we hope to have them here later on this school year to give us a more detailed explanation of what they offer in the community. Some food pantries, as we know that this is a tenuous time and people are having a rough time with hunger. So we have some food pantry information that is listed, as well as some more organizations sharing their resources. These are upcoming food Christmas giveaways for food. So we want you to share it. This one is tomorrow. We want to make sure people know that they can come out and they can get this food. And we want to make sure no one goes hungry. So please share this information. And I am going to welcome Avi Joseph, who is an epidemiologist with Cook County Health Department. Avi is going to give the communicable disease update. And Avi, you can take control if you like. Hi, Avi.
Hey, thanks, Kelly. Um, yeah. I'm Avi. I'm gonna be with the communicable disease unit. And I'm gonna go through communicable disease happenings in our county. So first, starting with respiratory season updates. This is the landing page from our
Sorry to
res
interrupt. I don't think you took control yet. Do you see at the top of your screen it says take control?
oh, okay. Sorry about that.
That's okay. There you go.
Okay, good deal. Um, so this is the landing page for our respiratory dashboard. You can see on the left we have our big three pathogens, COVID, flu, and RSV. This is actually a screenshot from yesterday. So I think as of today, COVID has moved up into the low activity level, which I think we've seen that indicator from our test positivity, wastewater, and emergency room visits, and continue to monitor flu, which has been increasing and remains at that low activity level as well. Um, so looking at the percent of ED visits due to influenza, if you look at that graph on the left, um, that's showing last year compared to this year, and you can see we're already ahead of pace of last year's flu season, which was relatively severe. And then if you look at the split by age group, that blue line is, I believe, 0 to 4, ages 0 to 4, and the that orange yellow one is 5 to 17. So you can see a lot of these ED visits are driven by our pediatric population this season. And just for a numbers comparison to last year at this time, the percent of 0 to 4 year olds going to the ED due to influenza was 2.21%. This year it's 5.16%. And then for age 5 to 17 last year, it was 1.66%. And this year it's 4.84%. So definitely some concerning trends in terms of flu in our little ones. Looking at our lab data, that top graph is looking at percent positivity from our outpatient labs, and you can see we've started to creep up above the pace that we were at last year. And then for the bottom graph, that's looking at counts of influenza at our outpatient labs by subtype. I believe when I was on last time, I had mentioned this new evolved H3N2 subtype that had been causing some concern. And because our outpatient labs aren't routinely subtyping, we did a lot of those results are unknown. But if you kind of, I don't know if you can see that, but the breakdown of flu A is it's 25 H3N2 compared to 3 H1N1. So it does seem like here, just like in other countries, that H3N2 is driving the flu epidemic in our county. Looking at the wastewater data, again, just kind of telling us what other indicators are saying, which is that both COVID and flu are starting to rise at this point. And then wanted to specifically call out RSV in the really young population, ages 0 to 4. That is certainly driving some inpatient admissions in that age group, and wanted to call that out because in the last few years, it's relatively new that there's a vaccine available for pregnant women who are scheduled to give birth before or during the respiratory season. And there's also a couple of monoclonal antibody treatments available for, I believe, 0 to 8 month olds. That's available. That's really effective at preventing severe outcomes, hospitalization, ED visits, that kind of thing due to RSV. And then this is just looking at a comparison of ICU admissions due to COVID from last year to this year, and it's looking pretty similar on that front, at least as of now. I did want to really emphasize that it's not too late to get the flu and COVID vaccine. I had mentioned that potential vaccine mismatch because the H3N2 subtype has evolved in the months since vaccine strains were selected. However, there has been some good data published out of Europe, specifically that the indicating that the flu vaccine is still really effective against severe outcomes in children. Um, and CDC actually this week published some data from last season uh, indicating significantly decreased risk in ED visits for children who are vaccinated against COVID compared to those who weren't. And I say this just because here in Illinois, we are kind of behind pace in terms of vaccination. Last year at this time, I believe through November, 23.4% of Illinois residents had received a flu shot. This year, it's only 21.9%. And last year at this time, 10.8% of Illinois residents had received a COVID shot compared to only 6.8% this year. So really want to encourage that flu and vaccinate or that flu and COVID vaccination, especially in our pediatric population, where we can see that it's really effective at preventing emergency department visits, urgent care visits, that kind of thing. Especially you can see in this little graphic on the left that um, it's really effective in that young group, that age 6 months to 4 years, 76% reduction in risk of an ED visit, 56% for school age children. And then it might be a little bit hard to see, but that chart on the right is looking at vaccine effectiveness in England this season. And um, you can see that, this 75, 76% risk reduction in inpatient admission and ED visits. They do even specifically call out the H3N2 strain, which, people had kind of worried about that vaccine mismatch. And it seems like it's just effective as preventing severe disease in that strain as it is any other. Moving on to some non-respiratory topics that you may have been hearing about in the news. Something we've been hearing about a lot this year is measles. It's been, the worst year for measles in the U.S. in quite a long time. Almost 2,000 cases as of December 16th. We've had 14 in Illinois, 5 in our jurisdiction, so investigated by our health department. Um, we do expect to lose our measles elimination status. So measles has been considered eliminated in the U.S. since 2000. Um, Basically, every measles case or outbreak that occurred from 2000 to now was associated with travel or importation. But unfortunately, it does seem like WHO is going to declare that measles is no longer eliminated in the U.S. Starting next year. Um, a lot of those outbreaks in the Southwest have kind of burned out, Texas, Oklahoma, but there is still outbreaks ongoing in Utah and Arizona, and I think a particularly big one in South Carolina that's causing a lot of quarantine and kids missing school and that kind of thing. So um, I did want to call out that school nurses are have been really helpful for us when we've conducted measles investigations in the past. You guys are really helpful in terms of identifying who may be susceptible, who may be eligible for vaccine clinics or immunoglobulin, or who may have been exposed in a particular setting, that kind of thing. So continue to appreciate your guys' help when we run into these situations. Next thing you may have heard about is this infant botulism outbreak that's associated with By-Heart formula. So botulism is a rare but serious illness. It's caused by spores from this Clostridium botulinum bacteria. It causes this progressive paralytic illness that's um, almost always serious enough to warrant hospitalization and often results in death. There is a special antitoxin available for babies. It's called Baby Big. That's really useful in terms of reducing complications and minimizing the hospitalization stay, but it has to be requested specifically from this infant botulism treatment and prevention program and at the California Department of Public Health. That's actually the only place in the world that sources Baby Big. Um, so in November, I think California had noticed that they were getting a lot more requests for Baby Big than they normally do, and a lot of these were associated with Byhar formula, which kind of spurred this investigation. It's pretty interesting because this is actually the first botulism outbreak in the U.S. that was linked to formula. Typically, botulism in infants is associated with consumption of honey or sometimes uh, canned goods, like home canned goods, I think in particular. But this was the first one that was kind of associated with formula. And you can look at those numbers that 42% of infants who were treated with Baby Big um, had consumed powdered formula or the By-Heart powdered formula, despite By-Heart only making up 1% of the powdered formula market. So in November, FDA did issue a recall for all by heart formula. Unfortunately, they had to send a follow-up letter a month later, warning some of these large retailers, Target, Walmart, Kroger, um, because these retailers had failed to remove all by heart formula from their shelves. I think I even saw some media indicating that some of these retailers were just offering this recalled formula at a reduced price, which is certainly unfortunate. There's been 51 cases linked to this outbreak. Two of those were in Illinois, and actually they were both residents of suburban Cook County. Um, I do think this outbreak is a good example of collaboration in public health kind of across disciplines and jurisdictions because we were able to catch it pretty fast, I think, and nip it in the bud before it got too bad. Last thing I was going to talk about was Hep B vaccine guidance. You may have seen the news that CDC's Advisory Committee on Immunization Practices kind of scaled back their universal recommendation for Hep B vaccination at birth. That recommendation has actually been in place since 1991. And since that recommendation was put into place, infections in children have dropped 99%. Um, I thought this fact was interesting. So prior to the Hep B vaccination, we knew that about half of these Hep B infections in children were caused during delivery or from vertical transmission from the mother. But the other half we just didn't know, like they were an unknown source. And you can see that other point that I have that of the 600,000 adults in the US who have chronic Hep B, only half of them are aware. So that program of universal Hep B vaccination at birth has really been crucial to kind of preventing that cryptic transmission of Hep B and keeping our kids safe because even though a lot of the time Hep B is doesn't cause symptoms, it can cause, severe issues, jaundice, cirrhosis, liver failure, liver cancer, causing, kids to need liver transplants, all that kind of stuff. So here in Illinois, we have this newer Illinois Immunization Advisory Committee, and the bottom line is that here in Illinois, we are still recommending that universal Hep B vaccination at birth. That's going to continue to remain our policy here. And I think that was everything that I had. Here's my contact information. If you want to get added to our weekly respiratory report, you can email my colleague Courtney, and then I know you guys have your contacts in communicable disease, so feel free to continue reaching out to them. But that is our just kind of general office number if you need that. And I'll be sure to put all of these links and references and everything in the chat once I wrap up. Happy to take questions.
Thank you, Avi. That was very informative. I had no idea about the botulism outbreak. That's good to know. Are there any questions for Avi? If not, you can put them in the chat. He'll be happy to answer questions. I guess you are off the hook, sir. Thank you so much
Thank
for
you.
everything. Let me get. Thank you so much. And now I'd like to welcome Deja Neely, who is an employee with the Link and Option Center, and she's going to come to talk about their resources within the community. Hi, Deja.
Mm-mm. Hello, happy Friday to you all.
Happy Friday. I'll advance your slide so you can just tell me next slide.
Okay, you can go to the next slide. Well, before you go to the next slide, I just want to introduce myself. My name is Deja Neely. I'm the community liaison here at the Lincoln Option Center located in South Holland, Illinois, and also Hazel Crest, Illinois. We are a CCBHC, a Certified Community Behavioral Health Clinic. So I will be giving you guys just a little brief rundown on everything we have to offer here, and of course, open up the floor to have, if anybody wants to connect or anybody has any questions or anything further after this. So hello to you all, and we're going to get started. I'm ready. So we are the Lincoln Option Center. We do have 3 different locations. So we have our South Holland location, which is our main location for med management, admin services, case management, and that is also the location of our behavioral health clinic and our main admin building. Then we have one of our Hazel Crest locations that is 3330 West 177th Street. That is an admin building, and that is also where our doulas are stationed for our doula program. And we also have case managers that are on site at this location. And then we have our 24/7 crisis triage living room that I will explain and talk about more later. But that is located at 17577 South Kedzie. And of course, that is a 24/7 location. So I will explain more, but those are the 3 locations that we are working with currently. And we can go to the next slide. So, as I said before, we are a certified community behavioral health center. So, behavioral health clinic, actually. So, basically, 24/7, 365, we have crisis services to help people stabilize in the most clinically appropriate and least restrictive way. We have immediate screening and assessment services. We have patient-centered treatment planning. We have outpatient mental health and substance use services. We do have primary care screening and monitoring. We have target case management. We have psychiatric rehabilitation services, and we have a full clinical and operational commitment to peer and family support. So basically, with the CCBHC, we do have an actual clinic that can do assessments and diagnosis and med management as well. The reason CCBHCs are the reason they're around is meant to mitigate the amount of people that are going to healthcare locations such as emergency rooms or regular doctors trying to get psychiatric help. It is supposed to be a resource for that. So yes, that is the reason we are CCBHC. One second.
Don't you hate when you have to share your space with somebody? It's okay. We understand.
I am so sorry, you
No
all. I
problem.
apologize. I'm so sorry. So yes, we have treatment, assessment, and planning that goes on at that location. At that location, we have family healthcare providers. So we do make sure that each person who is a client here at the Lincoln Option Center, we do make sure that they do have primary care coordination. We make sure everyone has a primary care doctor. We also have primary care doctors that are on staff in case they do not. Um, we offer counseling services, whether it be group, whether it be family, whether it be individual, and we do that for all tiers. So it could be tier 1, tier 2, or tier 3 intervention that is needed. Um, yeah, so we have a doula program as well. And we have a living room program. So we're gonna go to the next slides and kind of break down and explain to you all the other parts of it. So our doula program, this is a community-based doula program that we are in partnership with Meridian Healthcare. And basically, it is a free program for low income moms who basically need a doula, find themselves pregnant. The doulas do specialize here in prenatal and postnatal care. So they will be with the mother the whole time of their pregnancy, making sure they have support, making sure they're accompanying them to their appointments, and also making sure that they're helping them with their birth plans and their transitions into motherhood. They also provide postnatal care to help the mother, like I said, assist with her transition to motherhood, but also to help mothers who may have multiple children. Like I've known them to help the moms who already had kids. Like if she wants specific time with her newborn, then they would, watch the other kids to give her that time. Or if she needs a break from the newborns and she wants to spend, time with her kids, then the doulas are allowed to do that as well, help with the children. So we have had a lot of success with our doula program. Every quarter, we do throw a community baby shower for our moms that are in the program who happen to be 6 months and up. And we take donations from all different types of companies so we can keep that going. And the mothers are gifted with their necessities for their child and strollers, car seats, and any necessities needed for the baby. So this program has, got us a lot of traction, and I feel like it is really needed in certain communities. So we are still taking referrals for this program because we have a lot of spots open, and we do have funding through Meridian to keep this going. So that is a rundown on our doula program. You can go to the next slide. Next, we have mobile crisis response. So at the with mobile crisis response is 24/7, 365, 7 days a week. On this flyer and on this slide, you can see the 1-800 number. That's the crisis line that you can call. So basically, with mobile crisis response, anybody who's going through a crisis can call the crisis hotline, and they can either speak to someone directly, or they can have a mobile crisis therapist dispatched to their location within the Cook County. It is free, and they do have a 90-minute window to get to someone. However, it never takes that long because, we usually have a good amount of people that are on staff at time, but 90 minutes is the legal window that we are allowed to have when it comes to crisis response. So you can call and get them dispatched directly to your location. And depending on the issue, if this person needs management, or they need to be assessed, or they maybe need to just be de-escalated and different stuff, then that's how the mobile crisis response person would go from there. Um, what would be considered non-life-threatening mental health crisis would be like loss of control, cyberbullying, domestic violence, anxiety, depression, aggression towards each other, suicidal ideations or attempts, and things of that nature. That is something that they are trained to handle, and they also are trained to transport people to any further medical help that they may need. So they are obligated to do that, and they are trained to do that as well, to make sure that if anybody needs any connection to other services, they make sure they get them. And also usually they do assessment They would do an assessment of everything after they have talked to the person, and then that person will be connected to further service for them. So if we have somebody who needs med management with us, they will be connected to that. If we have somebody who needs employment services, because we do have employment services, we have veteran resources, and stuff like that, or just regular case management, whether it be housing, transportation, and different stuff. Our case managers are very versed in connecting people to whatever resources they may need. So that is the next steps after they de-escalate and help that person in crisis. So this is a good resource to have for anybody. We do currently have partnerships with different police departments and fire departments for when people are calling the police or different stuff like that when they're having, regular family matters or crises that aren't necessarily a legal matter. So we've been a resource for that as well. So this program has been good. Like I said, this is a free resource that is funded by the state. So this is something that we are offering as well. Next slide. Okay, so this is our other Hazel Crest location, the 24/7 crisis triage living room. So the living room is open 24/7, 365. You must be 18 and up to come in there if you are without a guardian, of course. But basically, the living room is a safe space where we have recovery support specialists on staff. We have case managers on staff. We also have counselors and mobile crisis people who are on staff at that location. So anybody who may be going through any crisis, or they may need a safe space to go for a few hours, or they may be just looking for resources, or they may need food, or need shelter, that is what the living room is for. Usually we will have a person come in. If they're going through a crisis, we can connect them with a recovery support specialist or a counselor. And then also any additional resources they may need, whether it be employment, housing, case management, whatever, we will connect them to further resources there at that location. It is not a shelter, so a person can stay up to 23 hours. They would have to leave after that, but a person can come right back if they don't have anywhere to go. It is free. We get a lot of donations as far as food and clothes and different stuff like that. So a person will be able to just come there if they just need food or if they need some clothes or different things. So um, that is what the living room is. It's also just a drop-in site for people to come and talk to somebody, because some people have all they need, but they don't have a listening ear. So that's also what the living room is for. It is free. Again, all services are free. Unless they are connected to actual counseling services. Counseling services, we do take all forms of insurance. And even if the person does not have insurance, or it could be med management or assessments, anything that you need insurance for here, we don't turn people away if they do not have insurance. What we do is we just connect them with the case management and get them signed services anyway. And then the case managers will go from there to try to get them insurance. So next slide. That is pretty much it. The only things that were not in the slides we did talk about was our employment services. We do have employment specialists. We do have a veteran resource coordinator now who is helping our veterans make sure they secure all of their benefits and everything. And then also we are now doing DCFS and juvenile justice referrals as well. So we are constantly expanding, and that is our organization. Thank you guys so much for listening to me. Let me know if you guys have any questions, referrals, or if there's any partnerships or ideas that you all have. Feel free to message me in the chat, or I'll drop my email and our website in the chat as well for you all for any questions or any more information you may have. But thank you guys for having us here.
Thank you, Deja. This is fantastic organization, and I was very excited to have you come on so everyone can know how fabulous you and Dr. Twin Green, who is the executive director of the agency, are. And I'm glad that everyone is aware. If there are questions, feel free to put them in the chat or unmute yourself. But while I have you, I have a couple questions for your de-escalation program. I know you have partnerships with police departments, but we know that not all police are trained in how to de-escalate mental health issues. So would it be advisable to call you guys first, then maybe loop the police in?
So our partnerships with the police are meant for those people who happen to call them first when it's not actually a police matter. So
Okay.
that's when the police or the person who called the police are able to call our line, and basically we will be dispatched. And then after we get there, the police are free to leave because it's not no longer a police matter. If it's a mental health crisis, if it's something, you now have the mobile crisis person on site because they are trained to deal with things like that. So that's the main thing, is for us to be a buffer and mitigate some of the issues we have seen happen with law enforcement in the past, not necessarily knowing the appropriate way to deal with somebody who is in a mental health crisis or how to de-escalate mental health episodes. So, yeah.
Okay. There's a question in the chat. Can you share more about the DCFS/Juvenile Justice Program looks like and what individuals will be eligible for those services?
Okay. So that's a new program that we actually just started. Basically, it's just like we're receiving direct referrals now from the juvenile justice and people in surrounding areas, and then also from DCFS for direct services, whether it be counseling, whether it be drug and alcohol counseling, whether it be anger management, regular counseling services. That's all that's kind of about. We are receiving outside referrals as well. So if you know somebody who is DCFS involved or involved in the juvenile court system in any way, and they are looking to fulfill any of their probational things or anything that they need to have done for court purposes, we are not servicing those people as well. And it is free without charge because we do have funding for that matter now.
Fantastic. I have another question. Can you explain the three tiers for the mental health evaluation?
So when we say that, we service everybody of all tiers of mental health diagnosis. So we service the smallest level of anxiety, depression to the highest level where you have med management as far as people who may be diagnosed as being schizophrenic or being bipolar, manic bipolar, or anything that may be, a high tier diagnosis. That's just what I meant by that. Whatever mental
Okay.
health issues you could think of, basically.
Okay. Sounds great. Are there any other questions for Deja? This was very informative and fantastic. While we await to see if there may be some questions that may come up spontaneously, I just want to
Mhm.
reiterate that everyone can scan the first QR code, and then that will take you to our website, and it has the links for, it's going to be updated and has the links for our um, registration series for all of our webinars for the rest of the school year, as well as if you'd like to sign up to get our school's newsletter, which comes out monthly, and it gives you some up to the minute information as well as links for registration. And lastly, our January registration can be found at this QR code, where we will welcome the Public Health Institute, and they'll be here to discuss policies for free school lunch. I'll leave that up for a second and give people a chance to scan that. It doesn't look like there are any more questions. So it looks like we gave you guys a holiday gift, and we are finishing a little bit earlier than we planned. And I would like to thank Deja Neely and Avi Joseph for taking their time out to be on here. Happy holidays, everyone. Be well, get some rest, and we will see you back here January 16th. Thank you for your partnership. We certainly appreciate you. Have a great holiday.